We're all very human and fallible, and yet we live in a society that rewards pretending we're not fallible, or the range of acceptable fallibility is narrow.
We are constantly comparing our insides to other people's outsides and feeling inadequate and guilty, even ashamed.
Trying to blend in means parts of ourselves must disappear, and we must then live in fear that we will be found out.
Here, together, we will create a space where we can laugh, cry, and carry our suffering and hurts lightly.
In the service of being deeply human.
This is Life's Dirty Little Secrets.
Hello, I'm Chris McCurry, and this is Life's Dirty Little Secrets.
And I'm Emma Waddington, and today our guest is Dr. Eric Morris, an associate professor at Latrobe University and consultant clinical psychologist at Northern Health in Melbourne. With over 30 years' experience, he has worked both in Australia and in the UK, where I had the pleasure of meeting him for the first time. Gosh, I was thinking it's 20 years ago, probably, when we first met. And he has been working with specializing in complex mental health issues such as psychosis and bipolar disorder. He's trained in contextual cognitive behavioral therapies, and that's how we met, talking and loving acceptance and commitment therapy. And Eric has contributed significantly to the field through his clinical work, his teaching and research, including his PhD on psychological flexibility and auditory hallucinations. And he's authored several books and treatment manuals and has been a leading figure in the development of ACT for psychosis recovery. He's passionate about improving mental health outcomes through innovative, evidence-based approaches, and we are delighted to have him here today. Welcome, Eric.
Thanks very much, Emma and Chris. It is a pleasure to be here on your podcast. And I think it has been about that long that we've known each other, Emma. So, hey, there we go.
There we go. What great days those were. We had so much fun. Very early days in ACT, in the model that we all train and work in back in London.
Yes.
Many moons ago. Good old days. So today, Eric, you're going to talk to us about your area of expertise, your passion, which is psychosis. And in particular, we were having a brief conversation before we started about some of those boundaries that we sort of believe that are well established between psychosis, or what we might once upon a time have described as madness, and actually what is normal, that certain experiences are way more common than we'd like to think. And perhaps we can start there. Can you lead us in that?
Yes. And our conversation today, I guess I'm going to speak from my personal experience as a psychologist. You're right. Over the last 30 years, I have spent a good portion of my working life supporting people who have experienced psychosis. And in the kind of typical settings you would think a psychologist would work in. So in mental health settings, in public mental health settings. And I have supported people who've been diagnosed with schizophrenia and other psychotic disorders. But I would also like to share today in the podcast perhaps my own journey, if we want to say, about understanding psychosis. And I think that over the last 30 years, in the time I've been working, our ideas about what psychosis is have really changed, at least for psychological models. But I'm not sure the rest of the world has caught up to that. So when we talk about psychosis, I might use words like madness and other sort of more commonplace terms for this. And in part, that's because this is really old. We think that for as long as we've had been a species of humans, there have been some of us who've had unusual experiences. And we've had various explanations for that. And by unusual experiences, I mean perceptions that other people don't share, such as hearing a voice or seeing things that other people can't see, or developing ideas about what's happening that may seem really unusual to people. So in psychiatric parlance, we might talk about hallucinations and delusions, but also sort of as people, ever since they've been humans, have had varied in their sense of things standing out, things holding an importance that other people can't share. And the listener may think, well, some of those things sound like spiritual experiences, or, the types of perceptions that, some people are just really good at detecting patterns that other people can't, and this sort of thing. And that's what's really interesting about this area, is we're talking about ways of being human where your experiences might be wholly held by you and not necessarily by other people. And those experiences aren't necessarily wrong or bad. They're sort of part of the heritage we all have as human beings. And the interesting thing to know is we all have a propensity towards having unusual experiences like this. So hopefully our conversation sort of strays into those territory too. And I guess that the last thing I'll say is our ideas of psychosis and madness are really, in terms of thinking about something like a disorder like schizophrenia, are really only about 120, 130 years old, right? So these ideas of someone having a psychotic disorder are really kind of modern ideas. But the experiences of people, hearing voices, seeing things, holding unusual beliefs, of course, is as old as there have been human beings. And so our conception of madness, of difference, is highly dependent on our cultures and our history. And in talking in this area, one of the things that seems important to me is to recognize that because of those cultural ideas, there can be stigma and shame attached to these experiences. And yet, in another community, in another time, these experiences might be regarded differently. So that's what's interesting to me about this area, is like all sorts of mental health problems or issues, they're sort of culturally influenced, but also that propensity to have these experiences. These days, we understand just about every human being can under certain circumstances. And understanding those circumstances actually helps us to understand those experiences more. So I hope I'll touch upon each of those things as we go today.
First thing that came to my mind was Joan of Arc, and some of the other people, or you go back to Old Testament prophets or whomever. And there was a book many years ago, The Origins of Consciousness and the Breakdown of the Bicameral Mind.
Yeah,
Julian Jaynes. I think nobody really pays much attention to him anymore these days, but very interesting ideas about how the human mind developed to actually kind of shut down some of that stuff, and that there was social pressure to not have those experiences, or at least not talk about them. And I think kids get pressure, whether it's to stop having an imaginary friend or some other experience that kids seem to be very, very receptive to, that there's subtle and not so subtle messages that, that's not okay, that's not normal. And so I think a lot of this stuff does get suppressed or repressed.
Yeah. And I hear in that, like, okay, cultural influences, what the meaning of the time, makes of this. Because, there's scholarship about, for example, the ancient Greeks had at times a different idea of the human mind. The human mind was permeable. Gods and spirits could, of course, influence what you think and feel. While to me, like a modern conception of the mind, at least the Western conception that I was raised in, is your mind is yours. You shouldn't have alien experiences in it. There's maybe a privacy to your mind. think what you like, but, behave in a certain way, but we may also sometimes be taught that certain experiences of the mind are dangerous or wrong, right? As part of our socialization. And yet this maybe modern idea of the mind is not how, all humans experience their minds. And we know in, say, the Western tradition, the Greeks, the Romans, others experience their mind in a different way from, this separate, maybe Descartesian sort of idea of the mind. So without getting too highfalutin about it, it's like we all get taught maybe we have a mind and what's appropriate in it and what you're allowed to do with it. And then when some of us discover our minds can do a lot more than what we're taught, then that becomes interesting. And as I talk, I don't want to, suggest that having unusual experiences is always a blessing, is always great. I mean, if you hear a voice that no one else can hear and you don't welcome hearing that voice, or that voice says things to you that are distressing or worrying or distracting from what you want to do, this isn't necessarily something that you would welcome or want to have. And yet, it is in the capacity of the human mind to have those experiences. So this is what makes the area so interesting to me, is there have been other ways for us to experience our minds, and at other times in the Western tradition, but also across the world, people perceive minds differently and experiences differently. Certain experiences are not seen as illness in cultures other than the ones that I participate in, or are seen as important or marked with significance. And so that kind of relativism that comes with it sort of brings to me a humility about this. But it also points to, it's not the presence of these experiences that may be problematic as what they mean for someone. Whether they are supported by the communities you're in, or whether they're seen as signs of difference that stigma and shame may be attached to. And while that's like a nice intellectual idea, oh, right, okay, these things are not all seen the same way by people, that's also a really practical, it comes with it, a really practical approach to supporting people who have unusual experiences. That knowledge that, it's possible for just about anyone to have unusual experiences, and that the meaning of these experiences is not fixed. It's not necessarily a sign of disorder, or that you're broken or flawed, that you may hear a voice or be suspicious of other people, or hold ideas that other people don't hold.
So it's depathologizing as a good first step.
Yeah. Of experiences that are some of the most pathologized, stigmatized experiences, right? So, so that's what's interesting to me, is as I discovered this, I can remember as a graduate student, I was taught in a pretty typical way about psychosis and schizophrenia. And now when I look back on it, it was a very othering way and a very disorder-orientated way, and I came up in the 80s and the 90s, the decade of the brain, and, these experiences are, obviously the sign of disordered brains and this sort of thing. The great hope was brain science was going to, find, cures, and that didn't work out. And, there's probably some good reasons why that didn't work out, or genetic science. Well, this stuff that's sort of vaguely almost eugenics type stuff, that we can alter things so people don't have these experiences. And none of that worked out. Or the new wonder drug is going to, no, those new wonder drugs did not fundamentally improve things for many more people. And it's almost like we look in the wrong direction with this. if we look in a direction of pathology instead of trying to understand these experiences as human experiences. So that, as I came up and I discovered that sort of what I was taught was not the whole story. What I was taught was, a disordered conception of these experiences is sure a dominant conception, but there are other ways of understanding these experiences. And as you adopt other stances to understanding these experiences, you discover these experiences are more common than are suggested by a disorder perspective, and that many people have these experiences without having their lives shattered or, experiencing great distress. And that's really interesting too. So, yeah.
So it's got me, gosh, my head is buzzing. And I think this is wonderful because you're absolutely right. It is the most stigmatizing of all, or stigmatized of all the conditions. I had a couple of questions for you. So the fact that they're more prevalent than we think, they're not as disordered in as much as they don't always lead to a lot of dysfunction and distress. Are there certain communities where, so I'm living in Singapore and having worked in the local hospital, I've come to realize that certain communities have a different way of relating to unusual experiences, voices, and seeing things. They have a much more spiritual lens. They might believe that these are their ancestors and that they're a message. And I've seen multiple generations have these experiences. And it's a part of the family narrative. We are a family that has these special, different relationships with the other world.
Yeah.
And you can see how, it can create dysfunction if you relate to that in a different way, but for them, it doesn't.
Mm-hmm.
In their community, it's quite accepted and in some ways seen as special.
Yeah.
Not outside, not different, not a problem. So I was curious if for you, are there certain sort of communities, certain times in our lives where these unusual experiences are more common, and how to make sense of that?
I guess my journey has been to move from this disorder orientation to, it's the meaning of these experiences and the impact of these experiences rather than their presence. So, Emma and Chris, you may have been more enlightened than me, but in the way I was trained, I'd taken on the idea that there were people with serious mental health problems and everyone else, right? Or that there was this clear boundary between the person who's psychotic and the person who's not. But as you're describing there, Emma, once you start looking at these particular experiences, then different communities have different meanings about these experiences. And you may not be able to see the difference. Like I've worked with people from non-Western communities who can describe, this person hearing voices here, no, this is a sign of a spiritual awakening as part of possibly a journey of, like an initiation into deeper knowledge, or, and also point to someone in the same community and say, no, that person's mad. And that person also hears voices, but these sort of nuance between these experiences, or as you said at the start of our conversation, Chris, about Joan of Arc. Joan of Arc has all these unusual experiences, and yet as a national hero, achieved amazing things while also being an unusual person in her time, distinctive. And yet she heard voices, she had visions, she believed she had a special purpose. Many people with those experiences may not necessarily be functioning so well, but not all people with those experiences. So, so sometimes I think of the idea of schizophrenia and psychosis as a very Western sort of idea of, there's an idea of what good mental health is, and it is not having any unusual experiences. And yet when you start asking people in the general population about unusual ideas, unusual perceptions, you discover that many more people than those who are deemed psychotic have these experiences. Gemma, to your question of whether there's certain times in our lives, well, when we are younger, adolescents and younger people as a population have more unusual experiences than adults, and when we're older. And you might think about when you were a young person, my experience when I was a young person, the self-consciousness I felt, the permeability of my identity, that I had a sense of not being fixed or totally formed yet, of still learning how to be with my mind and what it did when I was stressed, but also trying to work out other people's intentions and where I fit in things, and then having certain experiences that sort of pushed my thinking and my perceiving in certain directions. So we now know that, yes, younger people have, and please forgive the technical language here, but younger people are more likely to have psychotic-like experiences. See how we sort of adjusting the language, so it's not psychosis, but psychotic-like, So, which, combines things like
or light.
Light could be the word too, yeah. Psychotic-like or psychotic light, yes. Hearing things that other people can't pick up, having brief experiences of seeing things other people can't see, having more blurring of the boundaries of you and your identity versus sort of other people, having experiences.
The first time you seriously fall in love with somebody, those boundaries just get evaporated.
Yeah.
That's probably right in line with some of those experiences.
Yes. Yeah. And I guess, I'm sort of picking on this. I'm using this term permeability a lot today, but there's that these boundaries between you and other people, or how strongly you can experience things so that your perceptions change. Like maybe many of us have had experiences like that when we were younger. We may still do as adults, but there's just much more likelihood of many more people having those experiences when they were younger people. And there's sort of all sorts of theories about why that is, including sort of neuroscience theories about synapses and pruning and all this sort of stuff. It's the thing I would take from it is it's there in us. It's possible to have these experiences. And many of us have these experiences and go on to function okay, live lives that we're free, free to act and do things that matter and this sort of thing. A few of us may get stuck in these experiences or persist, have persisting experiences. And then how we respond to those experiences, how others respond to those experiences seems to play a sort of a heavy role in how impactful those experiences are. So it's sort of getting at what we're talking about, Emma and Chris, is, if you have other people around you who say, you having this experience is okay. In fact, it might be part of something deep and special, right? Sure, and the experience might have moments of it being frightening, but it's understandable. That seems to help versus that's crazy, it's wrong, it's a sign that you're ill, it's something that other people shouldn't know about you because, you can see how these meanings can affect your experience of yourself and your mind. And so, again, that's what's interesting to me is I'd moved from a position of, it's very clear cut. You hear voices, you're psychotic. You hold really unusual ideas with a high degree of conviction. that could be a sign of psychosis to something a little more blurry and nuanced. And I think that's actually helped me to be a more useful helper with people who have these experiences, is to understand that this is on a continuum, on a spectrum, rather than a clear difference between people.
And I guess one of us, I'm just thinking about that. One of the really powerful pieces around that is that part of the pathology, part of the sort of place in which these unusual experiences become problematic is when we relate to them in the way that you described, that, they're a problem. And so if we layer their experience with that narrative, oh, well, you have a disorder, you might make that experience more distressing and more problematic. So we're kind of creating a problem.
Yeah, through our response. Yes.
Through our response. Yeah, even as clinicians, but also as a community. And I think it is because they have had this. And I wonder about, that would be a different conversation potentially, how we've got here to a place where we're so scared of psychosis-like experiences that, we find them so so intimidating, and we don't talk about them more freely. I remember in some of our earlier years, Eric, when we met, I remember meeting so many clinicians who talked to me about their experience. And there was these beautiful conversations, and it was part of what made, for me, the community that we belonged in so inviting and warm and connecting, was this permission to be.
Yeah.
It was permission to have. I remember one of my first workshop with Kelly Wilson in 2005. We were a handful of people because, it wasn't well known. And one of his big things was about, we're all in the same soup and we all carry our own things. And even as psychologists, even as clinicians, and for me, that felt like, oh, I found my home. Yeah. And I think that's what's so beautiful about what you're saying, is that part of that permission to be, part of those really sort of complex tapestry, which is a human experience, can include some of these unusual experiences too.
Yes.
And if we layer on top of that, this acceptance in this room and this curiosity, what's going on here? How's this working for me? Versus this categorizing as normal, abnormal, good, bad, mad, sane, then yes, we can hold it more lightly, as we talk about in this community, but also perhaps find a more expansive way of relating to each other, our experiences.
Yeah. It's pragmatic. To me, what you're describing is pragmatism, right? And that's, to me, what is exciting about taking a contextual view here is, I love ideas, as you can hear, but I love even more if I'm charged with doing a job of supporting people, can I be practical and useful? Can ideas guide my actions so that I can be useful to someone who might be in the darkest place, the most stuck position, and not because of what they've done, but because of the meanings around them, around it, or experiences they haven't chosen to have, but they are having. And what you're describing there, Emma, is part of the appeal for me, of contextual behavioral science is it honors lived experience. And you can't go to a Kelly Wilson workshop and not notice lived experience. Kelly will share, his experience, but he's encouraging you to connect with your own experience. And that's what's really interesting about this sort of radical behaviorism that's underneath this, is actually your experience does matter. Actually noticing it, and, in ACT terms, we might say making room for it, but maybe loosening up around categorizing and judging, might be pragmatic and useful, right? And then the more we know about human psychology, the more we discover that categorization sometimes is not a pragmatic move. Now, I work in healthcare systems where we do categorize who's mentally ill and who isn't. But it seems to me that's about resources, and then when you actually work with a person, you're interested in their experience and what they, aspire to, what they care about, their history, this sort of thing. And the label schizophrenia is not so useful to me as a helper as, well, what happened to you? What sense do you make of this? What, where are you wanting to go in life? If these experiences are going to, continue to be here, how might I work alongside you, the person having these experiences, to live as full or richer life as is possible for you, right? And so it gets down to a pragmatic piece. So I personally sort of think these efforts at categorization are, in some contexts, pragmatic and useful, but you shouldn't take them so seriously that you are structuring your interactions with other people based on this. I mean, when I meet with someone who has unusual experiences, it's not like I go in completely clean, a blank canvas. I'm shaped by my culture and my history about these experiences. So, and experiences can be singular. They can be very hard to understand. Someone's trying to put words to a visceral set of experiences they have, and it becomes confusing, at times. It's unusual. I mean, that's, we use the term unusual experiences or psychotic-like experiences. They might be very singular experiences, and the person is, through words, or writing things down or trying to convey to me what it's like to be them. And I'm doing my best with the limitations I have to understand. But in my experience as a helper, many times that categorization is actually is an additional limitation instead of use to me. It seems more useful to consider things from this sort of pragmatic science that we're into, Emma and Chris, of, all right, people have experiences, and those experiences can be context for them to be acting and behaving. The action of making sense of these experiences is influenced by all sorts of contingencies. Maybe I can co-create with this person a context that supports pragmatism and flexibility, and where it's useful, openness and compassion around these experiences, and not ignore that these experiences have meanings attached to them from the cultures that we're in or from your own history. And that seems to me, as a helper, the more useful thing is to have a framework for being open to human experience and thinking, well, what's useful here in this? And many times what isn't useful is to say, you're mad, you're crazy.
And when I imagine, there's so many unusual experiences. Like, I know that we're describing certain of the, hearing voices, paranoia, seeing things, but they're also unusual experience when it comes to body images and, how we think about ourselves and how preoccupied we get about cleanliness. Those are all under the unusual.
Yes.
So psychology is full of unusual experiences, and, relating to any of those, I want to live in a world where we can see that our experiences are vast. And I think conversations like ours today and other conversations that we've had on our podcast and conversations that we as clinicians are very privileged to have in our clinic rooms help me live in that world where I can see that we are complex And we have lots of ways of seeing the world, experiencing the world, understanding the world. But that pragmatic lens for me, thinking about how is this working for me? What is the life that I really want? And how do I have to hold these experiences in a way that helps me move in that direction? And if I think of some of the more neurodivergent community, they have a lot of experiences that are unusual. And perhaps in their community, it's more accepted. But to live in this community, there are certain expectations that, you can't go around saying you're hearing voices. Like, that's not a very useful behavior if you want to sit and get a job in an interview. Or I remember Emily Sanders, back in many, many years ago, talked to me about, her daughter wanting to get a job, having a certain haircut and certain outfits. And she said, well, there are certain jobs where, that's okay, but other jobs where you won't get a job if you look like that. And that's just what's expected of you. And I think in that's the context sensitivity that calls for us to think about, what's expected of us and how we have to adapt. But that doesn't mean that our experiences are good or bad.
Well, and in there, as you say that, Emma, is also that, well, context can change, expectations can change. What comes to mind to me as you describe that is a sort of in a post-industrial society, right? Like the one, like I had this image in my mind of, children learning to be obedient at school, or, how many of us who are knowledge workers, we work in offices in a very sort of, actually there's a sort of range of behaviors that you can display and not others, right? And what I mean by the sort of Taylorism of it is Taylor, who sort of came up with ideas of how people could work in factories so that human beings it didn't matter what type of human being you were, you could be sort of swapped in and out in terms of your role, right? How really those ideas of what are appropriate behaviors in an industrial society, like be quiet, pay attention, be diligent, show up on time at a certain time, handle being around lots of people working away at some task, like you can see how our schools are sort of little factories, or preparing you to work in the factory around lots of other people, And even our offices today, like some of us don't have a lot of job control. You've got to show up at a certain time. You've got to look a certain way and all this. That's all actually relatively new, in our culture. And people are pushing back against some of those norms. So, if what's to me awesome, one of the things that's awesome about recognizing neurodiversity is, why is the world organized this way? Why is it organized that you have to put up with certain sensory experiences or to contribute meaningfully, economically? I suspect a number of these norms were just created by, white men who didn't actually have to be in those places, right? They're just herding up people to do stuff for them, right?
They had private offices.
Yeah, they have the corner office where they can behave any way they want to, right?
No, but COVID kind of blew all that up.
Yes.
I mean, where all of a sudden people were like, I like working remotely, because I don't have to wear clothes that are incredibly uncomfortable and distracting, and don't have to smell other people. And now people are freaking out because they're being made to go back into their offices, and it's a huge adjustment again.
Yeah. And, perhaps it won't be going back, although there's a push for it and all this, there is also, a push against. Does the world have to stay the way the world of work, for example, have to stay the way it is? And I guess where this sort of loops with the psychosis thing is that we know that people in the developing world who have psychosis actually have better outcomes than people in the developed world. And there's various theories about why this might be, and it's no doubt it's multifaceted. But one of the ideas is, well, maybe in communities that aren't post-industrial communities, you may have a role, like you're not working in a sort of factory type office setting. You could be where you are and you have a role in your family, contributing to the family, or the world of work is sort of looser in terms of its expectations. Like there are more types of jobs and roles than the ones that are offered to us in highly industrialized, places. And so that's really interesting, as if you were sort of an arrogant Westerner thinking, oh, we have the best healthcare and outcomes, then have a look at psychosis. Because no, we don't, right? So our technological solutions and our ways of supporting people do not lead to the best outcomes for folk, and so that's what's interesting, as the ways we've pursued treating illness have not necessarily led to better care for people. And, and then, in a number of the societies that we're in, funding for mental health, for serious mental, helping people with serious mental health has been a mess. In the US, a lot of the treatment of psychosis is actually in prisons, high homelessness and this sort of thing. We haven't worked this out. And I would be bold enough to say some of the issues of categorization, who's ill, who isn't, the meaning we make of it, contribute to some of the not so great ways we're trying to support people. The other thing I think about with what you asked, Emma, is there's a fear of madness, right? And so there have always been people who don't fit in, or who are very troubled. And if you look at the history of psychiatric care, like I remember when I lived in London, I visited the Bethlehem Museum, so the Royal Bethlehem Hospital, where we get the term Bedlam from. It used to be based in the City of London, and then if you know London, it moved to where the Imperial War Museum is now, and then it got moved again to Sevenoaks in Kent. And there's a museum there. Now, this is Western Europe's longest-running psychiatric institution, 600 years of history. And if you want to be humble as a mental health professional, go visit that museum or check out the online, resources. You discover that people had all sorts of, wild and wondrous ideas of how to treat the mad. And we can look back 100 years ago, that was awful, that was silly. But can we really honestly say that what we're doing now is better, And in fact, maybe our conception of this is part of the problem. And that would sound all great. Oh, that's a political point Eric's making. But the data suggests this too, that once you start looking at who hears voices or who holds unusual ideas, then, the prediction was, 2 to 3% of people do. Well, no, it's up to 10% of people hear voices. And in terms of paranoid and suspicious ideas, it's 20 to 30% of us do, right? Now, maybe not to the severity or, with the impact that someone diagnosed with a psychotic disorder may experience, but that's way more people than was traditionally thought, right? And then the other idea is an idea from the late 60s, the stress vulnerability model of mental illness. It's already baked into psychiatry that with greater stress can be, the possibility of people having unusual experiences. And again, the work over the last 30 years has shown that when you put human beings in situations where they're profoundly isolated, or when they're under extreme stress, or, you disrupt their sleep enough that they get very little sleep, they're just more likely to have unusual experiences. And, those of us who've been parents, and particularly those of us in mothering roles, might have, no sleep and unusual experiences. I kind of know what you're talking about here, right? That it's contextual, right? Some people have a greater propensity to these experiences, but you put people under profound stress or deprivation or in situations where they're ostracized and lonely, and there's more likelihood of this. So it sort of points to two things to me. One is, all right, this is actually more common than we think. And as a helper, that's useful, if I'm working with an individual or family. But it also points to what are we doing with how we organize our societies that might be inadvertently creating more experiences for people to struggle with. And then, as you say, Emma, like our expectations of how you should behave. Well, who came up with those expectations? It's not like we drew up a plan and said, these are the best ways to behave for our health and well-being. They're probably the best ways to behave to make someone money, to produce lots of goods, but not necessarily for the health and well-being of people. And I know that's I'm being a bit radical in saying that, but it's good to be a contextualist with this, because you say, these are environments, these are contingencies that affect people's capacity to have some of these experiences. And we might be able to do things to influence those things.
I mean, this is not unlike what we've touched upon when we've talked about burnout, that contexts that are created to get maximum productivity and efficiency and obedience out of people tend to burn them out. And so these are systemic issues. These are cultural issues that we need to be seriously thinking about. And again, kind of going back to the whole, what do we do post-COVID and, reimagining, the office and things like that. It would be wonderful if we could see this as an opportunity to think, how can we be more humane, starting with, schools and moving on up to factories and office spaces and other environments that are stressful and that do demand a certain amount of conformity, but probably not to the degree and the rigidity that we find ourselves, being expected to adhere to.
That's certainly what I wonder about, is there certain norms might be questioned. I take heart from where I am in Australia. Our federal government has just announced a 5-year autism initiative. And one of the strands of it is about people's employment and the environments they're in, and how can we make workplaces more affirming, right? And to me, that's like, how do we alter these environments to be more comfortable environments for people who have a greater range of experiences, right? We all may, if we're workers, have to slightly contort ourselves into a shape to fit a role. It's good to question whether you have to contort yourself so much, you have to control yourself so much. I personally suspect that a number of these norms were just laid down at some point in the past and not really looked at in terms of how ergonomic they really are, or, how useful they are. And this is sort of where the question of psychosis sort of comes to me, is I can personally remember a time in my life when I was afraid of madness and personally afraid that I would go mad. Now, how did I end up being afraid of these experiences? I don't want to lose control. I want to hold on to what I have and this sort of thing. But I also am the product of my culture. When did I first learn about madness? TV or a book, or, stories of where unusual experiences are combined with being evil or being out of control, or, etc. So no one sort of comes to this totally open and curious, right? They already sort of, have a sort of view that's somewhat structured by their learning experiences. And yet, what was interesting to me as I read more and discovered more than just what my education had provided was there are all sorts of other ways of looking at this that could be useful, could be pragmatic. So the flexibility of, if you don't think of this as a disease or a disorder, if you think of this in some other way, like as, we talked about earlier, possibly a spiritual experience, possibly the capacity of the human mind is amazing. Our imaginative abilities, relating anything to anything. Yeah, wow. We can really have intense experiences that, experiences of awe, experiences that are where we can't really even put words to what's happening. That then, what that sort of may focus your efforts as a helper to what is important. Maybe it isn't necessarily about categorizing people as much as, all right, what is madness? I think in what you were both saying earlier, it might be preoccupation. It might be how afraid or lost you get in these experiences, whether you can do the things that matter to you, even with the experiences. And certainly I work with people who have trouble with that. Yeah, but yeah, also whether you yourself, the person with the experiences, have a range of ways of looking at and being with these experiences and finding your own personal agency in relation to this. And that seems the important bit to me. A categorical way of looking at this. I mean, how far do I go? Well, okay, a categorical way of looking at this, if you take that so literally, it used to be the old-fashioned, message that people would get if they got diagnosed with schizophrenia is, you'll never work. Maybe you'll never have a relationship. Maybe there's no hope for you, right? And that's not even true. Most people diagnosed with schizophrenia recover. Some people have episodic, they have episodes of psychosis. Sure, some people have persisting experiences, but a third of people diagnosed with schizophrenia never have another episode. So it's not, you can't tell from how severe someone's psychotic episode was when, say, you first meet them, what their recovery is going to be like. So these are the interesting things is that it's not like really, really mad. Oh, yeah, they're gonna have a hard life. It doesn't even sort of seem to work like that. So I've just grown more suspicious of if I can put it that way, of categorization, because it leads to maybe false stories about stuff, or unhelpful messages.
Well, we had Steve Hayes on who talked about this at length.
Yeah.
And, there's, basically the theme of there's no such thing as normal. And it was quite an interesting, talk if you've ever heard him give that particular speech.
Can I just actually, gosh, you've got me thinking, as you were relaying, where this idea of what is normal, what's not normal, and how our society is defining that, especially our Western society. A case that I worked on years ago came to mind here, where it was a young person in here that had unusual experiences. He was having a psychotic episode. Everyone was very upset and very worried. The school got involved and the services got involved. And when we went to meet the family, turns out mother had been having unusual experience her entire life and was living in the household, and grandmother.
Mm-hmm.
And they had never sought help. They had never needed support. It was just part for them of their spiritual understanding. And yet this young person who had described his experiences to the school counselor had activated an entire system.
Yes.
He was now talking about how much help he needed and how he needed medication. And his family was pushing back, saying, he's fine. Leave him with us. We know what to do. And it just kind of reflects exactly what you're describing, that understanding so influenced his experience versus his family experience. And he was quite torn between listening to what his family was saying. It was like, it's okay. You're here. This is your ancestors, I remember. And they were going to go off and move bones in graves as their way of relating to these unusual experiences versus school, psychiatrists, psychologists telling him, no. This is really bad news.
Yeah.
And that became much more distressing than the narrative that was being had at home. And it was a real contrast. And for me, it was the first time I had seen this before. I've then seen other instances, but really that different ways of seeing unusual experiences and what really is useful. Was it useful for us to come along with an entire army to tell them how to do this, or to support him with what felt like quite a useful narrative that maybe allowed him to continue to go to school and maybe allowed him to relate to his experience. But it was so jarring to what his new community was telling him.
And I mean, I find this very interesting too, because as a helper, there's a epistemic supremacy that sometimes comes with an illness narrative or a disorder narrative. Like, oh, that's the answer. When, I worked with lots of people from many cultures who you get the sense, their family says, well, that's very nice. Those Western doctors have said this. Well, we also have this view here, right? And I don't think it is so pragmatic and useful to have one versus the other and you must adopt, it's underneath should be pragmatism. So I think, sure, we should take, when a young person has unusual experiences, we should take this seriously and be watchful. And, because, these experiences, I mean, it could be that a person has an unusual experience, such as hearing a voice, but they find that experience comforting, they can function, they have a meaning around it that is, consistent with them, consistent with their culture. It works. And great. But you also have the person, sometimes who's so preoccupied, worried, feels dominated by that experience, may very well, have commands to do things that could be harmful to them or to other people. So, so there's a thing of, okay, we're not going to explain, go, oh, it's all good, having unusual experiences. No, it can be dangerous and threatening. But I want to support the person and the people around them to find a way of being with these experiences and being pragmatic about it. For a number of people, medications do help. But it's a pragmatic, I think, take a pragmatic lens on it. Has the medication helped to reduce the frequency or the intensity of the experience? What's the balance of the medication with side effects of the medication? We know that many people prescribed medications for psychosis stop taking these medications, and it's not because they lack insight. It's because, there's sexual side effects. There's effects about how tranquilized you feel. And like, it's sometimes, to me, a problem of imagination on the helper's side about how would you feel if, you're impotent or you're struggling to be able to think through things, or you can't follow a television program or something. I'm being an oldster here, a YouTube video, right? Because you're so tranquilized, right? So pragmatism seems to me to be the important bit here of, you don't have to adopt my explanation solely, and my explanation is only important if it helps you pragmatically, right? And so I'm kind of suggesting a whole bit of diffusion around the whole thing, but not a withdrawal from trying to be useful and helpful. It's just humility. You go visit the Bethlehem Royal Museum, 600 years. Everyone's had all sorts of amazing ideas about this, and that hasn't necessarily moved the dial all that much about supporting people's personal recovery. So your cherished ideas about what's going on for someone, hold them lightly, be prepared to be wrong, but keep the person at the forefront, their well-being, their identity, their recovery, their roles, what they aspire to. That's the key bit. And as we think about psychosis in a wider sense, then we also, in here is the actual lived experience of people with psychosis. We're talking about a group of people who have traditionally been voiceless, and these days they're not. There are people, lived experience experts who can speak in a much more informed, compelling way about this than I could ever do, about their own experience and what it's like to be a person with psychosis. And that's important in this, is what does the person want? Am I, as a helper, informed about what I can offer, but also humble about maybe my way is not the only way. Maybe, there might be things here in this person's community and their family that is way more impactful than what I have to offer. And this gets at things that like there's an approach called open dialogue developed in Finland, which situates the psychosis not inside the person, but as an issue in the community. And it's about communication in the community wrapped around the person who's experiencing psychosis. A different conception than there's something wrong inside of you. There's something wrong with us in our community if you've experienced madness. And how can we pragmatically address this together? Not to extinguish or get rid of unusual experiences, but to help the person feel connected and not so isolated, or to maybe deal with some of the maddening communication that might have led to this person becoming unwell. So there's some ways of looking at this that are different from who's mad and who isn't, right? And that's what's exciting to me about it is, I feel 30 years in, we're really just learning, if we listen and if we're open to understanding these experiences and understanding many more of us have these experiences than the stereotype.
Thank you so much, Eric. This is great.
Yes. Many more of us can talk about this. I realize my privilege today as a highly educated psychologist, and that's been my journey is opening my eyes more. And a functional perspective, of course, helped me to do that. Once I let go of categorization and disorder and I think functionally, then actually there's more here. Once I think of the person in their current and historical context, if I keep that at the heart of it, and all the rest are sort of language games that we play, and for what purpose? Some of that language is useful, some of it's not. What's going to be useful to this person? Then I think it sort of clarifies our purpose. And like you're saying, Emma, many more people, a conversation about this, not just held by an expert like me, claiming things about what is a common human experience, listening to all sorts of people about it. Because, I think that the way we've been thinking about this has not necessarily let us, in good directions. And so it may be time to learn more and be more curious and more open about it.
Absolutely. I look forward to those conversations. Thank you very much.
Thank you so much.
Yeah, thank you for the opportunity.
Thanks so much for tuning into the Life's Dirty Little Secrets podcast.
If you have any feedback for us or secrets for future episodes, you can email us at lifesdirtylittlesecretspodcast@gmail.com.
Be sure to follow us on Instagram at Life's Dirty Little Secrets or on Facebook at Life's Dirty Little Secrets Podcast.
We invite you to follow, rate, and review us on wherever you listen to this podcast. It is the best way to get our podcast out in front of new listeners.
We'll be back in a couple of weeks with more.
See you then.